Hi, good morning, everyone. This is Saurabh Agarwal from Heart Care Foundation of India. We are meeting for 107th weekly meeting for CMAAO. We are live on Saturday, 9:30 a.m. And this is a COVID update from National Medical Associations. We will be talking about the country updates from various countries. And I would like to invite first Dr. Monica Vasudev from USA, and she has to present some slides, and then followed by other countries. I'm sorry, I'm little having a bad throat, so I can't speak too much today. And I will invite Dr. Chong, who is joining in from Singapore, to chair the session. Thank you.
Thank you, Saurabh. Always a pleasure to see all of you.
Also, we have speakers for next 5-6 sessions. So I would like everybody to attend. We have Dr. We have a scientist from South Africa for 7th. We have Dr. Rahul Pandit coming up on next week, and some more sessions. We also have Dr. Ishi Khosla coming up for the nutrition, which is, I think, the most talked about session, which people have requested. So all the calendar will be shared very soon. Yeah, you can share the slides. I've given the permission.
Okay, can you hear me?
Yes,
we can hear.
Okay, perfect. Thank you. Just to give some updates, in the past week or 2 weeks, the CDC came out with its top 3 causes of death in the United States in 2021. And what you can see is COVID-19 was ranked 3rd in the top 3 causes of deaths, with 415,000 deaths attributed to COVID-19, falling behind all cancers and heart disease. We're kind of living in a new world of surveillance and looking at cases, hospitalizations, and fatalities. When we're looking at surveillance at the sewage, the wastewater sampling sites, you're seeing that the sampling sites are not evenly distributed across the country. And what you're seeing are colors that are popping up showing anywhere from 1%, and in this case, up to about 79%, depending on what state you're in, of virus levels that have been noted. And my state, which is the state of Wisconsin right here, shows you that you have an orange dot here indicating 60 to 79%. You're also seeing an orange dot here on the northern west coast of California. So we're starting to see cases that are seen in the sewage, and this is for the weeks of April 5th to April 19th. If you look for the week up until April 22nd, and you're looking at the cases that have been reported, what you're seeing in the blue is a positive increase in the number of cases. You're seeing 41% for Minnesota, 37% for Wisconsin, 37% for California, 35% for California, 37% for Texas, 33% for Florida. And so these are representing now that we are beginning to see an increased number of cases. What are these cases? These cases are showing majority of BA2, few BA 1.1, and a few of BA2 12.1, and those cases are beginning to rise and starting to displace the BA 1.1. Looking at other ways to detect cases, the FDA authorized the first coronavirus breath test on April 14th, 2022. We're going to continue to need different ways of testing. This was released based on data from 2,400 people that with or without symptoms. It accurately identified 91.2% of samples and 99.3% of negative samples. So it had a great negative predictive value and a pretty good sensitivity. Negative result means that they're truly negative. People who were positive should consider using a PCR test to determine if it was a true positive. So this was big news. We are seeing news coming from across the world, and I'm speaking now of what was said in the United States, that the news was to drop masks it happened earlier this week. This was news that was even given to pilots during en route in their flights, and in the middle of the flights, there were many media posts, social posts that where people just took off their masks in the middle of their journey. So I thought this was a funny cartoon. Can't make us wear those masks either. We really are beginning to feel the fatigue of being in this pandemic now in our third year and being asked to wear our masks. So what happened? So there was a judge that said that it was no longer necessary to wear masks. And now every major airline in the US and many airports now, although not all, will no longer enforce face coverings. And that include for the Uber, Lyft, and regional transportation methods such as Greyhound and Amtrak. The CDC came back and they said that CDC is continuing as assessment that at this time an order requiring masking in the indoor transportation corridor remains necessary for the public health. And I had just shown you what the surveillance data was and that the cases were rising. The CDC will continue to monitor public health conditions to determine whether such an order remains necessary. And the CDC believes this is a lawful order well within CDC's legal authority to protect the public health. So in response, the Department of Justice has filed an appeal to say that, yes, we do need mask mandates. And just as a summary, the federal mask mandate was announced in January of 2021, replacing the previous masking rules in 2020. Before the judge's decision, the mandate was set to last till May 3rd. So we pretty much just moved it up by a few weeks. So we're in a position now where we're going to have to learn to live with it, and it's going to be our personal decision as to what our behavior and it's going to be our behavior choices that will determine what our risk profile will be in terms of exposure. Will we or will we not choose to be vaccinated? Will we or will we not choose to be wearing a mask? Will we or will we not choose to go to those large public gatherings? But now there'll be less enforcement and more left to the individuals to choose. So I wanted to end that there because we are beginning to, I think, now go into this new chapter of learning to live with COVID. And that's all I have.
Thank you, Dr. Monica. I can't speak too much today. I'm just having a bad.
Let me speak.
I'll let you speak. Yeah.
Okay. Hi, everyone. Thank you, Monica, for giving us that little update on the situation in the US. I understand it's quite confusing, this mask mandate being struck down by a judge who was appointed by Donald Trump. And I think I read the New York Times on my phone, so it's quite confusing at the moment. I understand why they want to appeal or why they don't want to appeal or whatever, right?
Yes. Yes.
Yeah, it's quite confusing. Anyway, it's legal. It's quite complicated.
Yes, there's a lot of implications. Do we or do we not file an appeal? When do we file the appeal? And what are the implications for the CDC in the future to be able to make decisions and make recommendations? Yes.
Yeah, but I think it's important to protect the CDC's powers. I think going forward, it's very important to protect CDC's powers, that they are in charge of public health and not a judge. right? I think it's very clear that that you mustn't let the court overstep its boundaries. I mean, the judge is not a public health person, what? You know what I mean? So it's a bit ridiculous, I think. But anyway, I just update you with what's happening in Singapore. We have some news because yesterday we announced our COVID task force announced reduction of our DOSCON level, which is like your DEFCON level, like your military DEFCON. We call it DOSCON. So we've dropped it from orange to yellow, and we've lifted a lot of quite a number of measures. For example, group sizes has been lifted. Used to be 10 persons and below, now it's lifted. And then mask is still required indoors, but outdoors you don't need. And everybody can go back to work. It used to be that maybe 25% of people can go to work, then 50%, 75%. Now is everyone can return back to work. And at work, you don't need to wear your mask if you're sitting by yourself. I mean, if you're doing your work at your own workstation or your cubicle or your desk, you don't need to wear a mask. Previously, everybody in the office has to wear a mask. So these are some of the measures that have been lifted. And big events, more than 1,000 people. There is no more restriction in terms of used to be like you're only allowed a 50% capacity or a 75% capacity, but now that capacity has been lifted. So reality is we are trying to live with COVID. And pre-departure test before you come to Singapore is no longer needed if you're fully vaccinated. So fully vaccinated travelers are welcome. And a lot of our vaccination differentiated measures, which was actually to kind of like, well, the bad word we want to use is discriminate. Okay, discriminate those who are vaccinated and those who are not. Most of them have been lifted. And do you recall a long time ago, I was telling you guys about the phone, what we have on the phone, the electronic trace together apps and all that has been, all those requirements have been lifted. So here we are literally, and I think the number of cases in ICU due to COVID is now 0 in Singapore, 0. So I think we've had about 1 million and 1.1 million people who have caught COVID. So my ID colleagues tell me you can times that by 2 or 3. And with a population of 5 million, I think we pretty much hit herd immunity. And it was 90% BA2. So it's just ripped through the whole population very quickly, despite all the vaccines. We also have vaccinated the 4th dose for people above 80. But yesterday, the task force or the expert committee that is part of the task force says, if you're 60 to 79, you don't need the booster, but it's optional. And if you do the booster, it's optional. You won't be covered by the vaccine insurance because it's optional, right? And below 60, no vaccine needed. So 60 to 79, optional, right? But again, if anything happens to you, if you do the vaccine and anything happens to you, there's a fund to cover you if something happens to you because of the vaccine, because it's a national program. That fund will not be available, right? If something happens to you, like if you get myocarditis or something, right? So that's kind of like, you see where we are going. So reality, yes, we are living with COVID. It should be pretty much back to normal now. Thank you. Yes, Monica?
I think that all the changes that you're stating is pretty interesting, that it followed your Omicron wave. So your population has achieved a level of herd immunity through immunization and through infection.
Yeah.
It'll be interesting to see where you'll be in like 3 to 4 months from now when we start to see the waning of that immunity again.
Yes, actually, you're right. So one of the things that the task force talked about was, what if a new variant of concern came? Worst case scenario, they talked about the worst case scenario. A new variant of concern came and was more transmissible than Omicron or more deadly. That's the worst case scenario. Then they'll reactivate all the measures. So that's what they put a little caveat there at the end that that's what they would do lah. But otherwise, yeah, we had a massive wave of Omicron BA2. So I think with vaccination of 97%, and those who receive booster 70 over percent, I can't remember the exact figure, 70 something percent. I think we're there. We can't get it up higher anymore. I think we're maxed out on vaccination. So plus the wave, I think we've kind of like pretty much hit herd immunity. Yeah. So that's where we are at this point in time. So reality is, yeah, we are going back to pretty much normality here. And recently, I've seen a lot of my patients coming back from the foreign countries around us. So we have quite a lot of people coming from the various countries around us, medical tourism. So for the Indonesians are back, the Cambodians are back. I have some Vietnamese patients coming back. So we do get quite a large number of medical tourists from the region, and they're all starting to flow back into Singapore again. Yeah. Dr. Akhtar, you want to tell us anything about what's happening in South Africa?
Okay, thank you, Dr. Chong, Saurabh. Get well quickly. Thank you. South Africa, the numbers are going up now last 1 week, and especially last 24 hours, 4,631 new cases. Death rate is gone to 10th last 24 hours, and yesterday was tested 25,000, and that from 25,000 positivity rate was 10.5. And admission around the hospital, public and private hospital, 2,100. And out of that, 163 patients were admitted in ICU, 53 went on ventilation. And recovery rate is in South Africa is 96.7. And active cases still 23,000. Vaccine so far 34.5 million. Our booster doses are going very slow, and the borders are open. If you are vaccinated, you don't need to have a PCR test and just need a vaccination certificate. And the other thing we found now that people are getting sick, they're doing home testing, mostly rapid test, and they like to isolate themselves sometime, they don't disclose sometime. So numbers at the moment is not looking good because we were expecting a 5th wave in May. Look like we already started here. Thank you, Dr. Chong.
Thank you, Dr. Akhtar. Dr. Pillay, you want to tell us anything about what's happening back home?
Yeah, thank you. Even in India, there seems to be a trend towards having more cases. We reached a state where we had hardly 500 or 560 cases. But the last 1-2 weeks, there has been an increase. And today we have almost 2,562 cases per day. And this partly is because of use of mask by Delhi and Maharashtra. Because Delhi, which reported almost negligible number, now has more than 1,014 cases. There has been a sudden jump in number of cases. It could definitely be attributed to relaxation of COVID-appropriate behavior, particularly mask wearing. But now, seeing the upward trend, Delhi administration has again imposed strict COVID-appropriate behavior, including wearing of mask, and if you don't wear it, it is punishable. Similarly, Maharashtra was another state where there has been relaxation of the norms, and there again, the number of cases are increasing. Unfortunately, now because the number has come down, many states have stopped reporting the number of cases. To that extent, the data available is not absolutely correct. But then we don't feel that we are going for a fourth wave because the number still is very low and contribution has been mainly from two states, Maharashtra and Delhi, where mask wearing has been and other COVID appropriate behavior have been relaxed. Vaccination front, about 180 doses of vaccine has been administered so far. The booster dose, almost 3 lakhs of people have received it. And vaccination of children, again, it is being debated, and which vaccine has to be given and whether it has to be given is still under consideration for those between 8 and 14. But in some states, this is being pursued. The vaccine usage has come down to the extent that the Serum Institute of India has stopped manufacturing or production of vaccine. So they have millions of doses which is not being used, and it may sort of going to be wasted. So the Serum Institute has declared that they are ready to give it free of cost to any state or any nation. So that is regarding the vaccination and vaccine production. Hospitalization definitely is much less, hardly less than 1% are getting hospitalized, but the death rate definitely is there. And the variant BA2 and 3, which was reported almost 2 weeks ago in Bombay and Delhi, the number has not significantly gone up. So far, as per the data available, 300 cases only has been reported of these variants. And hospitalization among the variants has not been so far reported. All relaxation, all measures have been relaxed, and now apart from COVID appropriate behavior, we can more or less say that there is no restrictions. Schools are open, public transport is freely running, and there is no restriction in number of persons entering it. The theater, tourist centers, office, everything has returned to normal. Business, industry, everything is back to normal. Domestic flight, no restrictions at all, except that you had to wear a mask during your travel. And even the vaccination status is not looked into. International travel also, those coming in, RT-PCR is not done, no restrictions are there. So that's where we stand. There definitely is a little increase in number, particularly from 2 states where COVID appropriate behavior, even that was relaxed. But we don't feel that we are going for a fourth wave. But insistence on COVID appropriate behavior again is being done, and that's where we stand. Thank you.
Thank you, Dr. Pillai. Doctor, for the update from what's happening in India, and Dr. Salma, do you want to update us on what's happening?
Good morning, everyone. In Pakistan, it has gone down, but still the active cases are 3,368. And this is not coming down because we have more patients. Like last week, we had 108. And today we had 82 new cases. I think the reason is because there are a lot of political rallies going around in the country. And people over there are not masked. And we've had 1 death in the last 24 hours. If people behave intelligently and the government imposes some restrictions on these rallies and political meetings, I think we will be corona-free very soon. But it is a bit alarming because whatever the active cases are there in the range of 3 to 3,500, and there are more new cases than the recovered cases. Anyway, our population, 56.6% has been vaccinated, and we are still giving about 2 lakh new vaccines every day. So that is it. That's the update from Pakistan. Thank you.
Thank you, Dr. Salma. I don't think anybody else here is with us today. Any other comments from you, Monica, on the global situation?
I think we're in a wait and see. I think as we're it's going to be, let's see what happens now as we relax and as the vaccinations can hopefully kind of catch up now in the places where it wasn't before. So if India has excess vaccinations, this is a great opportunity to help the rest of the world catch up.
Yeah.
And with catching up of vaccinations, relaxing of rules and COVID restrictions, I think will allow us to move and kind of live through the rest of this pandemic. But in terms of where I would think, so the question I face now is, if you're 3 months or 4 months out from vaccination, where are you for getting another booster? If you had a choice to get a booster, would you be willing, like in Singapore, to get a booster at your own risk?
So 60 to 79, we are giving them an option. We have not mandated it, but again, there's no safety net. If you have a vaccine injury, you won't be eligible for because it's your choice. You won't be eligible for compensation. So it's kind of like a negative nudge there. You know what I mean? So that's the. But they've given you a choice basically, because there will be a group of people between 60 to 79. I mean, it's no magic cutoff, right? 80 years old is not a magic cutoff thing, right? There'll be people who are immunocompromised, blah, 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 sick, ill, in their 70s and so on, right? So that's...
Age is 50 in US, right? 50 and 4 months since last vaccination, and you can get your second booster.
Oh,
So,
is that right? 50?
Yeah.
Oh.
50 and older, yeah.
Is that a choice or is mandate? Well, there's never...
No, yeah. No, if you're 50 and older, you can go and you can get your second booster.
Wow.
Yeah.
Okay. But the vaccine rates in US are quite low, right? Compared to the rest of the world, right?
Yes.
Are you worried about the BA2 wave because I was looking at New York Times, there's some reports of BA2 waves here and there in certain states. Is that a worrying thing or?
So that's what I was showing you with the stool surveillance, and one was that the numbers are going up. We just came off of the Easter weekend, and so there's been a lot of travel as well. We are now seeing an uptick in the number of cases, even through non-sewer methods by looking at PCRs. And then again, we just had, now the government give free tests to everybody. You could request it through the USPS system and you could get 2 free test kits. So people are testing and maybe or may not staying at home. I don't know, but the reported cases are very underreported compared to the number of cases that exist. So am I worried? Yes, that there's going to be cases, but I don't see that coming up as hospitalizations. I don't see the hospitalization rate. I do not see the fatality rate. I think the greatest burden of what I see clinically in my clinic is long COVID. So it's not a conversation now about vaccination, or it's not even a conversation about am I sick or I'm referring 2 to 3 patients a day to the long COVID clinic, to the recovery clinic. And their experiences that they're sharing with me, who come back to me after they go, is that they say, I had brain fog. I didn't realize it was brain fog. I thought I was just frustrated and stressed out from the pandemic, but I got a referral to speech therapy. And I was wondering, why did I get a referral to speech therapy? They go through games, mental challenging games, like on your apps, on your phone, just word finding games or other Wordle, or I don't know what other games. And they said that just this small activity of focus for a few minutes every day was actually helping them. And they said, I don't know if it's helping me because I want to make it work. And therefore, and I'm feeling a perceived benefit because I thought brain fog was very subjective, or I'm feeling much better. The other thing they do is they send them to physical therapy. And they feel that physical therapy is beneficial to everybody anyway. So they come back from this long COVID clinic saying, I'm willing to accept a 5%, 10%, 15% improvement, and I've reached it. So I feel very happy. These are the conversations I'm having in my clinic. It's not about the illness, but I think it's a wait and watch. I think the next few weeks are going to be very critical in terms of understanding where these lifting of COVID restrictions is going to go.
I tell you what happened in October last year. I had a patient who was supposed to come and do a CT coronary angiogram. We do a lot of scans here because my clinic has CT and MR machines. So he was supposed to come back. Then he caught COVID. He caught Delta, and he came back 4 weeks after Delta. So I did a CT, a coronary angiogram for his arteries, and at the same time, I said, why don't we do a CT lung, right? Since I just open the window a bit more and just do the lung at a slightly more nominal cost. He said yes, and I found patches all over his lung. So I found patches all over his lung. So I sent him to a respiratory physician, and the respiratory physician says this is all post-COVID, and this is 4 weeks after, no symptoms. And only in retrospect, he said, maybe if I walk 10,000 steps, I feel a bit tired or a bit breathless, a bit, So he was completely fine. And lots of patches. Respiratory physicians say, do not treat, it'll go away by itself. So that's what we did. Since then, I have another 7 or 8 patients with patches in the lung, post-COVID. And not immediately, because they'll come to me 2 to 3 weeks later. And so anywhere between 2 to 6 weeks later, I see stuff in CT scans of the lung. So, that's the long COVID thing that you're talking about. A lot of them have lung changes without even knowing.
Yes. And this is where I feel like if those things and those changes are showing up on imaging, can you imagine on a microscopic level how many changes have happened after an infection? And then that comes back to the vaccination. So if you have a choice for vaccination and the risk of a potential reaction to a vaccine that you've already tolerated in the past,
yes,
compared with the perceived benefit of vaccination and preventing any of these changes. Yep, those are the things to consider now. Yeah.
Risk-benefit ratio. So actually, this long COVID business, I think there's more than meets the eye. I was very shocked by the Veterans Administration's study, the 150,000 veterans and all the high rates of MI and stroke and arrhythmias and ventricular, pulmonary embolism and DVT. Now, I want to ask you, Monica, have you seen this in clinical practice, those shocking figures that were seen in the Veterans Administration? Do you see those in clinical practice?
So because my practice is more focused on asthma and sinus issues. So a lot of these patients I'm seeing have anosmia and are having some respiratory decline. Like I'm now beginning to do aerosolizing generating procedures, so I can do spirometry. We're wearing complete PPE, face shield, and 95s. We're still doing that. We're having enough air exchanges in our room, so no more than 1 spirometry an hour. But now I'm getting data. So I have data now where I've done pre-pandemic spirometry before 2020. And I'm doing it now after these patients have had COVID and they've had dramatic changes in their spirometry. So in terms of the cardiac issues, I may not pick that up. I have seen multiple people over the last 2 years though, who've got new onset AFib, who've got a decline in their EF, who've had an acute coronary event of some sort, who are now on an anticoagulant. So a lot of coronary or cardiac care has happened, but I don't know if it was from pre-existing or if this was COVID associated.
Yes.
Yeah.
So just a different clinic. I should ask a cardiologist.
Yes.
But I think this long COVID, there's more than meets the eye. I always tell my patients that ultimately we have modified the disease with the vaccine, but it still is not a walk in the park. So I'm going to do my CT chorus and my CT lung next week, about 4 weeks after my COVID and dengue.
But you're not dissonant at all. You're good. You're good. I think the last thing I was going to say about this conversation is about the underutilization of antiviral therapies. Yeah. So there's another discussion about, Paxlovid and the Merck drug and Shield and you know, where is this medication being distributed? Who has access to it? And the concern for the hesitation from both the prescribers as well as the end users of these medications. And I think there's so much of this kind of fear related to the side effects of these medications that even if you have a 20% improvement, that's just the acute illness. If there's more to meet the eye with long COVID, why wouldn't you do whatever you could do right now to mitigate the infection so that you don't know the long-term benefits of using the therapy? We're so concerned about the risk, but I think that's another discussion for another day too.
Yeah, I just had a patient came in from Sri Lanka for his renal failure, very bad creatinines in the 700s. You know, a bit of acute on chronic kind of thing. Acute chronic was about 300, so acute on chronic. Huge guy, 35 BMI, huge fella. You know, male gender. So all the risks, and he caught COVID here in Singapore. So we're like, and he's 71. So I spoke to ID said, hey, you should take Paxlovid. Then he said, I don't want to take it because my EF is, my EGFR is really bad. I'm worried that Paxlovid will affect my creatinine and push it into end-stage renal failure. And we have no answer because there's no data on the safety of Paxlovid in ESRF or, you know, high creatinine situation. So and he was well. So he refused to take it. So, you know,
Right.
and monopravir, IV Remdesivir, you know, Evushil. We gave him all the options. And he said, no, I'm not touching anything because I feel okay. But if he deteriorated, and then the window was closing because it was on day 2, day 3, the window was closing. We couldn't give this, and there's no point giving beyond a week, right? So the window was closing while he was dithering away, you know. So I say your inaction is actually of a choice, right? If you dither away, you're actually choosing something. You're choosing not to do anything for your and well, so just this example just illustrates everything you said about Paxlovid and the role and the prescriber and the patient and just encapsulated everything you said.
Yes, yes.
Yeah. Okay. If there's not much happening today, then I know nobody else joining us, then I'll call an end to the session. Anybody else has any comments or any questions? If not, we'll call an end to today's session.
Thank you. I think we can end the session.
Thank you. Thank you, Monica. Thank you, everyone.
Thank you, everybody.
Thank you, Dr. Pillay. Thank you, Dr. Salma. Oh, she's not around anymore. Okay. Thank you, guys, and see you next week.
Thank you.
Bye. Get well.